Okay. Hello and welcome to our presentation, Prevention and Treatment of Eating Disorders and Body Image Concerns. I'm Fumi and this is Shane. We're both dietitians in Australia in private practice, passionate about eating disorders prevention and treatment in the athlete dancer world. We hope that this short 20-minute presentation today will help you as school, organization, teacher, dancer, as an individual to take part in this important matter of improving dancers' health. We have no affiliations or conflict of interest, and I will start off by just sharing with you some of the facts around dancers and their nutrition status. And some of these are actually quite astonishing. So what we know right now is that dancers with inadequate nutrition actually has higher incidences of injuries. And one of the top 5 factors that help prevent injuries in dancers is actually adequate nutrition and rest. The most common nutrient that's missing from the dancer right now is carbohydrates. And also an alarm bell is that 1 in 3 teenage dancers are at risk of iron deficiency, and we will probably know what kind of detrimental effect that has on their performance and training capacity. Also important to note is that the very high number, the 1 in 3 teenage dancers engaging in disordered eating behaviors, which is a high risk for eating disorders. And also very sadly that 1 in 3 dancers are really unhappy with their body. And also late menarche or irregular menstruation increases the risk of stress fractures in adulthood, which means, again, it has quite a big impact on the dancer's career and health, dance capacity in that professional world. So I'm going to hand over to Shane for him to talk about some of the facts around eating disorders.
Thanks, Fumi. So what we'll be running through now is a little bit around eating disorders in dancers and then also some screening tools. So when we have a look at eating disorders, we know that they're a serious mental illness that's often characterised with this unhelpful preoccupation around eating, exercise, and often weight. And where we see this becoming more prominent in dancers is some of that focus in terms of how the body looks, how the body moves, and those types of things. We also know that in terms of eating disorders, different data suggest that its prevalence is around about 10% in the general population, and that in dancers, there's 3 times the risk of people developing an eating disorder, with around about 12% of dancers and 16.4% of ballet dancers in some studies being indicated that there are eating disorder prevalence there. When we start looking at the risks of having an eating disorder and being in that dance space, and Fumi's touched on this a little bit, is there's the idea of poor performance, increased injury, mental health risk, and certain body systems become compromised. And what we tend to see is as some of these risk factors play out, people for a range of different reasons tend to become more entrenched in the eating disorder behaviour as they aim to seek better performance and try and recover from their injury, etc. This slide won't move. Oh. So having a look at common eating disorder myths, we know that eating disorders certainly don't develop because a person wants to lose weight. And this, we sometimes come across this in dances where a person might feel they're bigger than what they want to be and they want to therefore maybe lose a little bit of weight. that desire to lose weight doesn't necessarily constitute the development of an eating disorder, but it may present a somewhat of an increased risk. The idea that as long as you eat, you can fix anorexia nervosa. You know, that's a really, really strong myth we try and dispel with people, because with being a mental health illness, anorexia nervosa is much more than just eating. It's also having a look at your relationship with food, relationship with emotions, relationships with movement, etc., and that broader context of mental health and well-being. Binge eating is not necessarily due to a lack of self-discipline, and we often hear this come up often when we're doing presentations and having discussions with people. Binge eating is as much a symptom of an eating disorder as is dietary restriction. Eating disorders will fix itself someday. We often find when we're treating people or when we're talking to people with an eating disorder, sometimes they're waiting for the right time to start treatment. And we often say to them that, you know, the right time will never really present itself. It's around starting treatment and moving forward. And eating disorders require a lot of hard and often intensive work in order to overcome them. Another myth is that dance, especially ballet itself, causes eating disorders. We know there's absolutely no evidence of that, and we know that there are lots of people who do dance and ballet without developing anything that might even resemble an eating disorder. It's not an eating disorder unless you're seriously underweight. So the way we talk about this is that eating disorders don't discriminate, and they don't discriminate on gender, they don't discriminate on culture, they don't discriminate on religion, and they also don't discriminate on weight. So people can have an eating disorder at any weight, any BMI. It's not just people who are underweight. And then as an extension to that, it's sometimes thought that anorexia is really the only eating disorder that is life-threatening. And what we tend to understand is any eating disorder, irrespective of the diagnosis, is as life-threatening as any of the other eating disorders. And that's because eating disorders have an impact on a range of body systems, and that they can influence the person's health and in serious cases, also their life. The other thing we want to have a look at in terms of the specific context as it relates to dance and sport is what we call relative energy deficiency in sport. And this is where, as dietitians and medical practitioners, etc., we might look at the imbalance between energy input and energy output. Now, what we tend to see when this repeats itself over time, and the interesting point here is it only needs to be 5 days of a negative energy balance for bone health to start to be negatively impacted on. But the main impact of REDS, and it's multifaceted, is it impacts on performance, and it also impacts on health and well-being. And the International Olympic Committee have got a really nice summary paper on REDS that will talk in a lot more detail around the impact of performance and health and well-being if you're interested in chasing that one up. And so a primary goal of treatment when we're working with dancers and athletes is to prevent this relative energy deficiency in sport. And the way we facilitate that is by providing people with adequate nutrition education, both at a information level and also a practical level, how to construct good meals, how to construct adequate meal plans, how to replace nutrition after a fairly intensive dance session, that type of thing. Try and involving dietitians who have expertise in this area, and also putting in place some screening processes within the dance environment to help identify risk factors and therefore support potentially prevention and also early intervention, so that we can start getting on top of these things before it develops into a more sinister eating disorder itself.
Thank you, Shane. So I'll take over for the next few slides in looking at, well, all that, knowing those risks and dangers of eating disorders and the relative energy deficiency in sports that Shane has explained to us. I believe we all agree that early intervention and prevention are vital to ensure dancers are. But what is making this hard? So One is the lack of specialized healthcare, especially how it's really hard to find a dance specific health practitioner. So compared to other sports, there aren't many people available out there. And this leads to often dancers receiving helpful advice from healthcare providers, such as just stop dancing. And for those of you who are listening, watching this today, would probably know how harmful that sentence can be for a dancer, especially if they're looking into a professional career or they are professional already. And how there's a lack of understanding of dance-specific nutrition and healthcare leads to a lot of the signs and symptoms being dismissed by healthcare providers. So what that looks like is oftentimes the very common inadequate nutrition, which can be sometimes intentional or sometimes unintentional, like when a dancer moves to a school or summer intensive. Those kind of inadequate nutrition and or excessive training load compared to what can handle at stage is dismissed by the result. We also want to understand that there's a lot of secrecy and stigma around eating disorders. So the dancer could feel shame and or guilt of having an eating disorder, which makes it very difficult for them to actually speak up and seek help. And the very real fear that if they reveal to their teacher, family, friends, school, company about this struggle, that it might put them in trouble, or worse, it might put them out of dancing. Also, often there is a lack of understanding and support from the family and friends, both in and outside of dance, and or even teachers and the workplace, which is the dance company. So knowing those really difficult barriers that have for so long been hindering dancers to get the adequate support and treatment possible, what can we do to move forward and actually make positive changes? So we want to look at how to create and practice all levels. And I'm just going to pass it back to Shane as he will talk about some really practical screening tools that can be used from today on.
Thanks, Fumi. So we're just going to spend a little bit of time now reviewing two screening tools that can be, fairly well effectively used in the dance environment as well as the general environment as well. And this first one is what we call the ESP. So it was really developed for the primary care setting. And the thing I like about this one is it's quite neutral in the questions that it asks. It's very non-judgmental. And so you can see the questions here. So the first one is, are you satisfied with your eating patterns? Do you ever eat in secret? Does your weight affect the way you feel about yourself? Have any members of your family suffered with an eating disorder? Or do you currently suffer with, or have you ever suffered in the past with an eating disorder? So as you can see, it's a 5-question screening tool. When we've looked at the evaluation of this tool, there's really 2 key factors, 2 key questions that you can, if you want to streamline it a little bit further, you can use to screen. And they're questions 1 and 3. So are you satisfied with your eating patterns? And does your weight affect the way you feel about yourself? So if you get responses to those 2 questions that are somewhat indicative of somebody having a troublesome relationship with their eating or their weight, that would indicate that further support may be beneficial for them in terms of trying to tease that out a little bit more. And then there's also another screening tool that can be used as well. And the screening tool that we're sort of looking at with that next one is called the SCOFF. And the SCOFF is a screening tool that's more commonly used very much in an eating disorder specific setting, but can also be used in primary care as well, and sport-based settings. The thing about the SCOFF, I think, is it's probably a little bit more to the point than the ESP. And for some people, it is an American-based screening tool. So we do have to have that translation from stone into kilograms in there. But again, it's a 5-question screening tool. Do you ever make yourself sick or vomit because you feel uncomfortably full? Do you worry you have lost control over how much you eat? Have you recently lost more than 1 stone in a 3-month period, with 1 stone being the equivalent of 6 kilograms? Do you believe yourself to be fat when others say you are thin? And would you say that food dominates your life? And also your cognitions is another thing we would look at there. So with those 2 screening tools, you can build them into an intake process, you can build them into the medical review, you can build them into a process that is relative to your specific environment, that just tries to identify people who may be either struggling with an eating disorder or potentially vulnerable to the development of an eating disorder. And then it's trying to have a look at how we can link these people in with care to support that from an early intervention point of view. When people are struggling around eating and weight concerns, we have a nutritional guideline or a framework that we tend to use that really encapsulates the 5 key principles in terms of eating disorder recovery or just having a good relationship with food. So the framework is called the Raves Framework, and as you can see, there's 5 key components to it. So the first one is we want people to try and participate in regular eating and fueling their body on a regular basis. So that might mean having, say, 3 main meals across the day and also a couple of snacks as well. Then we look at adequate nourishment and whether the person's getting enough nutrition to support the level of dance that they're doing. And from that point of view, we might look at their specific nutritional requirements around protein, carbohydrates, and energy. And by doing that, we're also trying to make sure there's enough energy on board to prevent that relative energy deficiency in sport we spoke about earlier. We have a look at the variety of foods that people are eating and trying to expand upon that. One of the reasons we do this is because we generally find that people who struggle with eating have a number of dietary rules and therefore limit the variety of food that they eat. We look at eating in social situations, so whether that be with family, friends, cafes, eating at dance school, etc. And then spontaneity and flexibility in terms of how they manage their eating from more of an intuitive perspective, which really sets them up to have a good relationship with food moving forward.
Thank you, Shane. So those are some tools that can be used pretty much from today. And so knowing those tools there are those useful tools available, I wanted to look into the responsibilities and duty of care of different levels of people who are involved in dance and dancers' health, specifically around dance schools and companies, the teachers, the healthcare professionals, and the dancers themselves. So when we look at schools and companies, the responsibility that they have is to have healthcare, dance-specific healthcare available in the form of possibly an in-house team or, more realistically, a local referral network. So knowing doctors, psychologists, dietitians, physios who specialize in dance, have the understanding of dance and the dancer's needs. Also, the schools and companies' responsibility is to actually have a proper protocol and guideline for nutrition for dancers and also eating disorders management in the school company setting, and these will need to be developed by experts as well. Also, schools and companies have the responsibility to actually do no harm. So the act of, or the encouragement of, body shaming or eating disorder behaviors, which are often very encouraged by certain members of schools and companies, they cannot be tolerated. When it comes to then the teachers level, the responsibility they have is to know what kind of healthcare teams and persons are available, and to be able to connect their dancers to those resources. Also having that communication line active with parents, guardians of the dancers, especially if they're underage, or that family involvement is going to be helpful. Also, they have the responsibility to enforce those protocols and guidelines about nutrition and eating disorders management at the school and or the organisation. And they can also actively participate in promoting inclusive language in their classroom, and also to maintain confidentiality. When it comes to healthcare professionals, our responsibility is to have really good communication with the dancer, building rapport, and also with people involved in their career and life, including the teachers, the school, the company, families, parents, especially when it comes to eating disorder treatment, making sure that we are involving the necessary people in the process of the recovery journey. And also to liaise with the entire team for the treatment process, not doing everything on your own. And again, to maintain confidentiality by the laws. What are the responsibilities of the dancers themselves when it comes to these healthcare needs? Dancers have the responsibility to seek help and guidance and support. If they are struggling, they need to let us know. And to communicate that with someone you trust, whether that's the teacher, your family member, friends, or a healthcare professional. And to be connected to the treatment care that you need. They have the responsibility to also work collaboratively, because it is an active process instead of a passive treatment. And also beyond that food nutrition, there are things that can be done as well, such as upskilling in the area of social media literacy. I'm pretty sure none of us can go without social media these days. So if you're involved in it, using it, knowing how to use the more pros of it instead of the cons. So we hope that this short presentation has given you a starting point, if this is something still quite new to you, or it has given you extra ideas and resources, practical tools to onboard your plans and protocols around eating disorders, prevention and treatment. If you have any questions, always feel free to reach out to us on these contacts. And if you're after some references, here they are. So thank you so much for listening in. We hope that you have a wonderful day and that this has helped you take things a bit more further for a positive future.
Thank you.